Everyone wants to be healthy, but like anything else worthwhile, good health takes planning ahead.
What are you doing?
A healthy heart is essential to a normal life and good health. Good habits can help maintain that healthy heart. There are a lot of people that wish they had started good health habits earlier in life.
Oh, pack and a half, sometimes 2 packs a day, yeah. I don't know whether we realize a lot of pressure that we're under, you know, until all of a sudden something hits us. But the pressure, along with the smoking and other things that you're doing or not doing, contributes to you dropping flat of your back. And
what kind of habits are important for a healthy heart? Well, a balanced diet, low in cholesterol and saturated fats, moderate exercise, and avoiding or controlling diseases such as obesity, hypertension, and diabetes. It is most important to stop smoking. Not allowing those everyday tensions of life, that stress, to get out of control is also important.
You have to have something else. You have to be able to flee. You have to do it through exercise, through hobbies, and being able to relax. It's going to be there tomorrow.
So it's not just the things that you do or the places that you go, but your attitude that's at the heart of good health. If you wait until you have problems to do something about your health, you've waited too long. See your family doctor or American Heart Association for further information about good habits for a healthy heart. This is Dr. Tom Whitfield, Channel 5 Eyewitness News. For most people, it begins with what we call epigastric pain. You know it as heartburn, but for others, it may begin with severe bleeding in the stomach.
An ulcer is a breakage, a defect in the protective lining of the stomach or the duodenum.
Real raw feeling, stinging sensation-like feeling in it when it was really bothering you. It just hurt all the way through. I mean, just straight through. Just felt like somebody had a knife sticking in your back. That's what it felt like.
Ulcers are caused and correlate very highly with the amount of stomach acidity that a patient or person may have.
Here's a picture of an ulcer as it appears in the stomach. Looks like a crater and is formed by acid. Here's what it looks like on an X-ray. 150,000 people will have their first ulcer this year. Men have twice as many ulcers as women. Tobacco, alcohol, and caffeine make ulcers worse. Certain medications, such as aspirin and aspirin-like products, aggravate ulcers. And yes, you might worry yourself into an ulcer. You know, most illnesses tend to get better in warmer weather, but ulcers get worse in the spring and in the fall. On our next segment, we'll talk about ulcer treatment and how you can really spell relief. This is Dr. Tom Whitfield, Channel 5 Eyewitness News. Are there things that made it feel better?
Just the medicine, milk sometimes.
The goal of ulcer therapy is controlling the amount of acid in the stomach. Potent antacids will do this, but
Actually, food's the best antacid of all, the best absorber of acid. And so if you go all day long with an ulcer and you don't eat, you have a fairly active level of acid in your intestinal tract.
Don't skip meals and use antacids or snacks between meals to absorb excess acid. Neuromedications such as Tagamet and Zantac lower the secretion of acid and help many people avoid surgery. Other medications such as Carafate coat the ulcer and thus protect it from the irritating acid. Anti-anxiety medications are also useful, but ulcers take time to heal, usually 4 to 8 weeks. Treating ulcers by surgery has decreased, but surgical treatment still has a place in ulcer therapy.
Still a significant number of patients, however, who will have their ulcer healed, but due to the natural history or the natural evolution of their problem, they will get the ulcer as soon as they get off of the medicine. Those patients in general, if they're good surgical risks, probably ought to go ahead and have an operation.
Research continues as to why some people get ulcers and others don't. But for those who do, it's getting easier to spell relief. This is Dr. Tom Whitfield, Channel 5 Eyewitness News.